session. We have to say thank you to Dr. Ara Tahmassian and Dr. Crozas to being with us. Dr. Tahmassian is responsible for the oversight of the development and implementation of policies related to research compliance at Harvard University, and works to manage potential risk at the university by integrating and coordinating the significant compliance requirements set by many institutions. And Dr. Crozas is the Chief Data Science and Technology Officer at Institute of Quantitative Social Science, IQSS, at Harvard University. She has a very long experience leading the Dataverse project and building data management and analyzing systems in academia and biotechnology companies. So thank you for being with us, and we will start the presentation.
Thank you very much, and good afternoon, and thank you everyone for coming. Is it the regulatory? No, it's which one is the regulatory? It's this one, yeah. Okay, perfect. Thank you very much. So what I would like to ask is, please, as we go along, ask questions and make this interactive. You know, I'm going to kind of very quickly go through some of the slides, and I'm going to jump some of the other slides because I already am aware of some of the things that you are doing. So, you know, please make this as discussion as we can. Ask questions, challenge whatever we say. So it's a two-part. One is sort of on the regulatory affairs or regulatory and ethical related issues. The second one is a little bit more practical on the role of the ethics committee and how to run the animal facilities and so on. And I'm happy to answer any questions that you have. The presentation, you know, as you will see as we go through this, is really sort of intended to be much more neutral rather than focused on any particular set of regulations. So that we do talk a little bit about the US regulations versus EU or Canadian regulations. And the purpose of that, the way this presentation was put together, was to kind of provide a platform for people who want to do collaboration with other countries and scientists from other places. So as we go along, again, if there are specifics, please ask the questions. And, you know, I think almost everyone in this room recognizes sort of both the ethical and the sort of moral questions associated with animal sort of welfare and the use of animals in research. And it is, let's be honest, it is a relatively controversial subject where there are a lot of people who think that this should not be done anymore, and that we should use, you know, sort of anything other than animals. You know, the unfortunate thing, as we all know, is that that is not practical in every aspect of it, that there are many, many aspects of the research that still require the use of animals, that you have to use animal as a model. Interestingly, sort of one thing which is always lost in this discussion is that there are some actual recommended and requirements. For example, in the United States, there is a regulatory requirement that drugs, devices, you know, sort of new drugs cannot be used in humans before they've been tested in animals. So whether you like it or not, it's a mandatory requirement. If you look at the Nuremberg Code, which is the European sort of standard for the use of human subjects, actually the third principle in the Nuremberg Code is that no experimentation will be conducted in humans until it's been tested in animals first. So sort of that is a thing that whether, you know, we can't just go straight into the humans without having tested with the animals. So that's sort of, as we go through this discussion, you know, we can have a philosophical argument, but that's sort of the basic principle that we operate from, that we have to do this, but in order to do this, we have to do it in a very ethical and moral and, you know, have the animal welfare, in fact. So I'm not going, I mean, we've already sort of addressed some of this. The one thing that we always tell our faculty, students, and everyone across the US is that the use of animals is a privilege. It's not a right. And a privilege can be given to you if you do the right thing, and it can be taken away from you if you do the wrong thing. As an example or a comparison, I have always used the driver permit, your license to drive car. You do not have a right to drive a car, it's a privilege. If you don't follow the rules, if you don't follow the regulations, if you violate every single traffic regulation, at some point they're going to take away. And that's sort of very critical, at least for us, from our perspective. In every institution that I have been before Harvard, this has been a complete and total kind of criteria for us. And that if you fail to obey institutional policies and the laws and regulations, we will take away the privilege to use the animals. And there might be other penalties. There might be academic decisions which are taken in promotion and tenure in other cases. But at the minimum, the committee will actually remove the privilege of using the animals. And when we are using, I will learn how to use this. Okay. Because this has come up in a couple of discussions earlier, is that there is a big distinction between the use of humans and animals, is that in a human research, there is this thing called informed consent. That in order to participate in a subject, as a subject in a human subject research, you have to be informed and you have to consent to it, you have to sign a paper. We don't have that in the animal world. The animals cannot consent for themselves, which then puts a lot of the pressure on the ethics committee, on the veterinarians and other people who are reviewing the proposed use. And in essence, you become the spokesperson or the defender, or sort of you're looking for the animal welfare in that sense. And that's sort of a philosophical kind of approach that if you look at the US regulations, Canadian and or EU, is your facility ALAC accredited? Okay. Are you moving towards ALAC accredited? Yeah. So as you're familiar, I mean, ALAC is also looking fundamentally to the same principles, is that sort of, is the committee more interested? Your institutional animal care and use committee, is it more interested in animal welfare or anything else? And that's sort of the fundamental criteria. So the committee becomes the defender of the rights of the animal and make sure that so that it's protected. Sort of when you're looking at sort of the interactions between animals and humans, whether it's in kind of natural format with your pets or whether it's with the research animals, it's very much the same, is that the value of the interaction, and this is the way, if you are kind of, again, looking at ALAC accreditation, the socialization of the animals, and whether the animals are being kept socially and together is a critical element. And in most jurisdictions, if you are going to isolate and have a single animal, single cage, there has to be a scientific justification for it. You cannot isolate because that's sort of, they lose that interaction criteria. And of course, sort of the quality of life for the animals, in fact, is, I don't know about you here, but over the years, in many instances, my staff have complained that we provide better housing for the animals and much more comfortable because they're all ventilated cages and air-conditioned rooms than their offices are. And to some extent, it's probably true. Yeah, but really, sort of it's very important to the quality of life. And of course, sort of the quality of death itself, the euthanasia methods to minimize the pain and distress. And I want to go back very quickly from a scientific basis to say that the quality of the life is actually a very critical element, in my opinion, and there are not a lot of papers published on this, on the science and outcome of the science itself. Because if you have an animal which is actually not being kept under sort of proper care and it's under stress, there are all kinds of chemistry and other hormonal changes that happens. And what does it do to your experimental outcomes? And there are a lot of studies which have been done that actually show, and in fact, sort of Mercedes' specialty is this reproducibility, and it has been so that there's a lot of problems with the reproducibility of the results in the animals is because the conditions are not the same, and one animal was more stressed, so that the outcomes were different. So I think that's sort of, there is a scientific value other than just the ethical and moral value of sort of how you provide that. And of course, sort of the quality of death for the animals. Ultimately, you know, most animals are utilized, 95+% of the research animals at the end of the day. That's the end of life for them. And how are we treating them? And how are we minimizing the pain and distress in those animals? And then, you know, so that the contextual factors are, you know, pretty much there are factors that affect humans or other animals that are not directly involved. The interaction will also be taken into account, you know. And this is important for the animal care facility because there is a stress that comes with this activity on the staff who are dealing with the animals. And I think that you need to be aware of that as well, even though it's not an animal welfare issue, but it's something that you need to be aware of. In terms of the regulations, you know, sort of the primary, there are, you know, sort of in the US, the National Institute of Health, the NIH, has the Office of the Lab Animal Welfare, you know, or OLA, that regulates any use of animals. And this is very important. How many of you are familiar with the US regulations? Great. So under the US regulations, Animal Welfare Act does not recognize birds, mice, and rats, which were bred for research purposes as animals. They were excluded from the definition of the animal, specifically. So in order to regulate birds, rats, and mice, then, you know, so the Office of Lab Animal Welfare has actually established criteria, which means now we have two agencies. You know, one is the OLA and the other one is the non-OLA that regulates. Then, as I said, there is the federal regulations, which is under the United States Department of Agriculture, Animal Plant and Health Inspection Services, or APHIS, which regulates the Animal Welfare Act, anything and everything except rats, mice, and birds, you know. And then, you know, in general, I think most of you are aware of that we're required under the regulations, whether it's the OLA or under the USDA regulations, we are required to have an institutional animal care and use committee, or IACUC, most commonly known, whose responsibility is the overall management of the program. In other words, you know, they are supposed to be reviewing all protocols for research. They're supposed to do semi-annual inspections of all the facilities to make sure that the facilities are in compliance. And as part of that semi-annual inspections, they're also supposed to do an evaluation of the overall program and determine whether the program is effective or not. They also are supposed to review any deviations, any violations, any, you know, sort of, I would say, infractions that happens that they need to, then they are responsible for taking care of actions. There is a very interesting criteria which has been actually there, sort of, it's written in law. Number one is the attending veterinarian. There is a mandatory under the Animal Welfare Act that you have to have an attending veterinarian who has specialty in lab animals. It can't be a regular veterinarian, somebody who has lab animal, and he or she has to be consulted in all of the USDA regulated animals and anything which is category C or above, pain and distress. So you need veterinary consultation and sign off. The second thing which is very important, in order to maintain the independence of the IACUC, the Animal Care and Use Committee, the institutional official who's ultimately the individual at the institution who's responsible for the animal care and use cannot overrule a negative finding of the committee. They can overrule a positive finding. What it means is that if you submit a protocol to the committee and the committee says, no, you can't do this research, it's not justified, the institutional official cannot change that. But if the Animal Care and Use Committee says, yes, you can do, the institutional official can say, I don't want you to do this kind of research at our institution, for whatever reason. But it's very important, that is to maintain the independence of the committee. So that once the committee votes no, that's it. You know, you can appeal to the committee, but if the committee still says no, it's done. Yes?
How often it happens?
Actually, it happens a lot more frequently than you think. You know, I mean, when my last position at Boston University, Boston Medical Center, I probably would get one of these every 2 or 3 months. because for a variety of reasons, the committee would decide that it's, that you have not justified or you're not providing adequate care or sort of your follow-up is not good enough, they would reject it. Now, usually we would kind of, the faculty would come and complain to me about the fact that it's, and my advice always was go back and find out, talk to them, find out what's the reason, and let's see if we can work with the committee to make the changes that they wanted. And in some cases, the answer is a flat no. Most of them ended up to be, sort of category E, which is the, sort of unalleviated pain category, water deprivation, food deprivation, if there was no justification and there were other reward mechanisms that you can use, almost always would be rejected initially. I mean, one of the things was that obviously with food or water restrictions, as you probably know, a lot of the faculty initially starts immediately saying we will hold water for 24 hours. You can't do that. You can reduce the water, but there has to be a baseline minimum. So that's kind of often. And again, I've already mentioned that you need to have a veterinarian familiar with the species. You have to have a variety of scientists from the institution to be a member of the committee. And this, I don't know if you have this or not, but there is a person whose primary work is non-scientific. This is the so-called community, the lay person. Somebody from the public not associated with the university and is another scientist. And they are supposed to be sort of the conscience of the community at the committee. It can't be your brother or cousin who works somewhere else. It really has to be a community member who comes in and provides you. I think we've already talked about this, but if you look at the Public Health Service, essentially the key things that they do is the transportation, care, use of an animal should be in accordance with the Animal Welfare Act and other applicable federal law guidelines and policies. And what this means is that in the US, unfortunately, one of the problems we have is that a lot of the time, the same subject is regulated by multiple of agencies. So even though, so the Animal Welfare Act, for example, specifically talks about the welfare of the animals and so on, US Department of Transportation actually sort of regulates the transportation industry. So if you're using sort of airplanes or trains or even road transportation, then there are additional requirements, and that's what sort of you will see this in a lot of kind of US documents that you get for the grants. They talk about other applicable federal regulations, and that's what it is, because you have this sort of wide spectrum of the requirements. And again, I think you already know most of this, that animals selected should be an appropriate species. This is another reason that often, sort of studies might be rejected by the committee initially because they want to use non-human primates, and the question is that why can't do the same thing using mice? So that you always try to go for the lower, sort of species of the categories. The proper use, minimization of stress and discomfort and pain. Again, this is sort of what the committee spends most of their time, at least the ones that I've been involved with, sort of debating and discussing. And this kind of, how do you, or do you need to do alleviation of any pain? And if so, what is the proper analgesic, at what frequency? And this becomes more important when you're doing surgical procedures and, so that the requirements for post-surgical care. If you look at the USDA sort of annual analysis of the violations that they have issued, this item ends up to be always on some of the very top cases. And in part, the reason is because a lot of the time people will put in their protocol that we will monitor the animal every 6 hours after surgery, or I will administer analgesics or painkillers, or every 7 hours. And then for whatever reason, they can make it every 6 hours, it becomes 7 hours, now it's a violation of the protocol. Because you had committed to a 7 hour time, 6 hour, 7 hour time frame, you didn't do it. So one of my recommendations always is, instead of putting a number, put a range, that every 6 to 8 hours. because then you have a 2-hour window. It's the same thing with the doses, by the way. Instead of saying that we will administer, 2 milligrams off, put down 2 to 3, or 2 to 4, because you may have reason why, as an example, you go in and you look at the animal post-surgery and the animal has actually recovered a lot faster than you expected. And you really don't want to administer as much painkiller. But again, if you have that range rather than a single number, if it's a single number, you're obligated to do that. If you don't, it's a deviation from the protocol. And as you probably are aware, you cannot deviate from your protocol unless it's been approved by the IACUC. So you are stuck with the protocol. There are some exceptions that if there is an animal welfare issue, if your attending veterinarian approves it, they can give an exception because they are essentially the experts. But then you still have to go back to the IACUC and let the IACUC know and make the changes. But that's the only time you can deviate if a veterinarian is actually giving you positive, sort of affirmative variation. And again, talking about, this is we've already talked about some of these issues, and it's very important that, if you cannot, in other words, you have to have an endpoint. That's what this means is that in your protocol, one of the things that they look at is, for example, if you're doing a cancer study and you're doing a tumor, one of the things that you have to justify and you have to say, what is the maximum size of the tumor and what is the point that once it gets to there, you will euthanize the animal. Because at that point, you are now reaching a point where the tumor is too large and it's causing additional stress, pain, and discomfort for the animal. So essentially, you have to identify and justify the end point. At what's the end point? And finally, but not, one of the most important things, that the investigators and other personnel shall be appropriately qualified, experienced for conducting procedures on living animals. And again, when we say it's appropriately qualified, it's absolutely critical element that I think every IACUC or every animal committee that it's looking needs to evaluate what is the role of each individual on that project. And if my job in the project is once a day to go in and look at the animals and maybe weigh them, that's a different strategy. The amount of training that I need is a lot different. All I need to understand how to properly pick the animal and hold the animal. On the other hand, if my job is to do a insertion of sub-Q pump, that's a completely different process. And the training that this person needs is totally different. The person who is in the lab, primarily responsible for euthanasia, needs to really understand the proper euthanasia. So again, I think one of the things that the IACUCs need to do is to ask questions about what is the role of each individual on the protocol, and make sure that individual is properly trained for that activity, that they're qualified to do whatever it is that they're being asked to do. And again, we've already talked about it, is that you can't have exceptions unless it's been approved. I think you are kind of all familiar with this. This is the guide for care and use of lab animals. And even though this is a guidance document, and it was issued by the National Research Council, actually it's by ILAR, which is the Institute of Lab Animal Research in the National Academy, it has become actually a regulatory document because the NIH, Office of Lab Animal Welfare, actually has referenced this document in their policy. That's a controversial issue. I'm part of a committee which is kind of arguing whether NIH has the ability to do that, but the answer is yes. What they have done is they have taken a document which was supposed to be a guidance document, and by referencing it in their policy, they have made it a mandatory document. And if you go to the OLA's website, and if you look at they have a, if you do an Office of Lab Animal Welfare, go to OLA, and if you look at the Q&A, they now will tell you, according to their policy, this guidance is considered as the minimum standard. And the expectation is that everyone will be exceeding the standard. So just sort of, I wanted to emphasize that because there's a lot of people, including in the US, who still really think that this is nothing more than a guidance document. If you are working with federal funding from the US government, NIH, NSF, and so on, this has become now part of the regulatory mandates. And again, I think the critical part, or one of the most important things, and I think you already are aware of this, is the so-called 3 R's, which is the refining the experimental procedures to minimize pain to the animal, reduction, which is use as few animals as statistically possible, and replacement, whenever possible, replace the use of the animals. Yes?
So this guidance applies only to public funded projects?
Right now, yes.
So the rats, the other animals are not included in the animal welfare?
They are included in the definition for the NIH. NIH, the Office of Lab Animal Welfare, regulates rats, mice, and birds. So this actually applies.
Funded projects?
Yes.
And
Yeah.
those that are not public funded?
Yes, but here's the problem. If you are running an animal care facility, or if you're a researcher, you know how difficult it is to separate different funded animals from each other, because a lot of the time the same project is funded from 2 or 3 different sources. So as a result of that, in essence now, everyone is following the same standard regardless of the source of funding, because it's going to be very difficult, at least sort of in the US. There are very, very few researchers who have one single source of funding, one grant for all of their research. You have grants from NIH, you have grants from NSF, you have grants from Department of Energy. You know, you have grants from private funders, you know, Gates Foundation, Diabetes Foundation, you know, American Heart Association, etc. And it becomes very, very difficult. So in essence, and the reason I said we are trying to sort of fix that problem, if we can, is because that has now essentially elevated this for all research into a regulation. Does that answer? I know you don't want to hear that, but yeah. By the way, the one thing just to quickly point out, this reduction of as few animals as statistically possible is currently being debated a lot, including at the National Institute of Health, because one of the problems is that there's a lot of studies which have been done where the results aren't showing up, you know, that even though the results are good results, but statistically there's a question about that the numbers were adequate or not. And I think there was this debate going on now as to whether or not, by just keeping the statistics to as low as possible, that we have actually caused a bigger problem with the outcomes. Because we have reduced the sample size, we have reduced the diversity of the sample itself, and actually the Deputy Director of the NIH, Dr. Lauer, recently in one of his blogs had sort of suggested that NIH may be looking at the possibility of funding less number of studies, but with the larger animal population, because then that sort of allows to the expansion of the statistically more significant. So it's just something that you know, even though we are supposed to look at it, but it's we shouldn't be just reducing numbers for the sake of numbers. It has to, you know, I think as you look at this, take the statistics, but also look at the scientific kind of outcome, and that too few animals may not necessarily yield a good result. It might be a good statistics, you know, but not a good result. In terms of the European Union, there is an EU directive, you know, which was last updated in 2013, and the directive requires that any research being done or carried out in accordance, you know, within the EU is carried out in accordance with the approval of an ethics committee, which is similar to the IACUC approval in the US, and that any changes to the project are submitted for approval prior to their, you know, sort of implementation. Again, very similar set of standards, the slight differences in the sort of description. But if you go down the list of all of the requirements of the animal care in this directive from the European Parliament, you will actually see that it's very similar to, and in part because most of them are using the guide. You know, so the guide from the National Academy was supposed to be the guide that everyone follows. And again, you know, sort of they talk about the appropriate use of species and numbers, use of analgesia anesthetics, design of the procedures, and the relevance to human and or animal health and their advantages of knowledge. This is a little bit different than the American requirements because you need to justify the use of animals and how it relates either to animal health or human health. So you have to be a little bit more specific if you are applying to the European Community funding. So that's kind of in your projects. And avoid or minimization of discomfort and distress. So it's very similar set of criteria. If you look at Canada, Canada works under the Canadian Council on Animal Care, and very similar to EU and US requirements. And again, you know, they are, if you're applying for the National Science and Engineering Council or the Canadian Institute of Health Research, which is equivalent of their NIH, they have very similar requirements that you have actually to follow the same guidelines. And again, if you look at the principle of the, you know, refine, reduce, and replace, and the use of anesthetics, analgesia, and euthanasia is very common. And again, you know, sort of, they do provide a little bit more specifics that, you know, if you want to, for your projects, that you have to have a purpose, a description of the project, discuss the alternatives, the procedures, and the end point. At what point do you actually go ahead and euthanize? You know, what is the morbidity point of the animals? And sort of, again, just kind of look at the end is that if you want to apply for funding, and here is, you know, and you will get copies of the slides will be made available. There's a lot of references that you can go and actually look at. But if you are going to use animals for research and you're looking for funding collaborative internationally, you have to follow these requirements. There's no ifs and buts. Now, with the US, there is one sort of minor requirement that ALAC accreditation is actually is sort of one of the conditions that NIH has. So if you go to the OLA, Office of Lab Animal Welfare, to register your IACUC and your program, and if you look under the assurance, once you start applying for that OLA assurance, it's sort of after you have identified the institution, who's the veterinarian, who's the institutional official, and so on, then the next question, it asks you if you are a ALAC accredited facility, yes or no. If you're ALAC accredited facility, and I can't remember if it's category 1 or 2, but sort of then that means your application actually has shorter, and there's less detail that you have to provide because you already have gone through a lot of those documentation under the ALAC category. If you are not ALAC accredited, then you have to submit a tremendous amount of additional documentation and actually almost step by step, how does the IACUC use? What are your criteria? All of your procedures. Pretty much as you're preparing for ALAC, think of it, you almost have to submit an ALAC application because they will ask for a lot of those data and details. Similarly, when you are collaborating with a US institution, so let's say that if you want to collaborate with a colleague at Harvard and you are going to do some of the animal work, because Harvard is an ALAC accredited, we cannot give a sub-award to an entity which is not ALAC accredited. So that sort of minimizes the amount, and I understand that you guys are actually working towards the ALAC. But you know, the only other option, again, is that we have someone do a site visit and sort of assess that your procedures are equivalent to ALAC. So ALAC, even though it is a voluntary accreditation, but it actually does carry a fair amount of advantages. So, and I understand that you are moving towards ALAC accreditation. Any questions or comments on this part, on the regulatory? Please.
To the number of animals?
Yes.
Is true that NIH is requiring that you use females and males for the experiments now?
Very good question. And that is actually this is part of this discussion that is going on because, there's this question of reproducibility and whether or not, sort of the animal research is yielding two things. One, whether it can be reproduced, Second one, whether the results, and why is it that often a drug or sort of a method will work properly in an animal population, once you go into the humans, it doesn't work. And one of the questions which has come up now is that, is it because we are not using as diversity of the population in the mice, sexes, for example? Are we limiting to just male, or are we just limiting to female? And then we're taking the results, which then doesn't work in female patients or humans when it worked with, sort of the animals. Also, there's sort of, so that's one of the questions. So I think, as far as I know, they haven't come out specifically and asked for a criteria yet, but I will not be surprised if, as part of this broader discussion of how do you improve the value of the animal research, that this question doesn't come up. Because remember, if you're applying for human subject research right now, when you submit your application to a human ethics committee, there are two sets of information that you have to provide. One is who is being included, the so-called inclusion criteria. So you can say that we are including women ages X to 60. And then justification for that is because we are looking at this particular set of traits in causing breast cancer in women of childbearing age. So you can have very specifically. Then you have to give exclusion criteria. Then you have to say, within that age range, is there anything or anyone you're excluding? For example, you can say that we will exclude all the women who have a history or a family history of breast cancer, okay? And justify that, why you want to do it. We don't have similar thing in the animal care. Nobody asks why, are you using males, females? Why are you excluding? If you are doing diabetes, are we looking at the sort of the whole spectrum? So that's the discussion which is going on, and I think it's going to become one of the criteria that to improve the science or outcome of the science, the committees will be asked to look at. So does that answer the question? Yes?
Yes, I have a confusion
Sure.
with the ALAC certification.
Yes.
Because ALAC demand us to follow the guide and the climate regulation. But with those two documents, there are many things from the USA regulations that are not included.
Yes.
So are we okay with that?
Yes. Now, unless there is anything in Colombian regulation that contradicts that. There are some countries, I know China has, there's some issues in China, because there's some specific requirements in China that contradicts some of the conditions. So as long as it doesn't contradict, I mean, look, if you follow the guide itself as is, my understanding of at least 18, 20 countries that I work with, you pretty much meet all the requirements, because almost everyone has taken the guide, which is supposed to be a guide initially, and just sort of managed, has written their regulation or their criteria around the guide. And the guide was supposed to be a best practices document. So if you're following the guide, which is what ALAC asks, and remember that ALAC is now, sort of, I don't remember the exact number, but is actually accrediting probably in about 25 countries, 25, 30 different countries where ALAC is actually accrediting facilities. So they understand sort of the diversity of the regulatory area, and I think that's to a great extent why the guide has become the fundamental document that they put their standards. So, other questions? All right, so that was sort of more for the regulatory. And, I don't want, because I think most of you know this, so I'm not going to spend a lot of time on this. But again, is this sort of question of what is distress. And I just wanted to define this, that the most common definition in almost all of the regulatory frameworks that you look at is that it's defined as a state in which an animal cannot escape from or adapt to an external or internal stressor or conditions it experiences, resulting in negative effects upon its well-being, okay? And this is sort of critical, and the reason it's critical is because if you look at it highlighted that the animal cannot escape from, because in the wild, if an animal is stressed, they run. I mean, or they hide, or they go to their burrows, or they climb up a tree. In lab animal environment, we can't do this because they're sort of in a cage or in a confined space. So I think that's where sometimes makes the definition, especially with a little bit kind of difficult to make the faculty understand or the researchers understand, because they say, well, in the wild, this doesn't happen. But there's a reason, because they run away. So I think that sort of becomes an important thing. Actually, conversely to this, one of the flaws and one of the complaints we get a lot from field researchers is that the IACUC, or the ethics committee, is actually using the criteria which is for lab animals for the field work. And that they're not sort of giving that modification. So I think if you have field work, you need to start sort of looking at that. And actually, if you look at the guide itself, the guide actually has a sort of criteria which said that for example, euthanasia or other cases and so on, you can use recommendations of the professional organization that, so the American Society of Ornithologists, or your, so the Mammalogy Society has requirements that you could follow that. So I strongly recommend that you look at that. I co-chair with one of the folks from the OLA, and I, Axel Wolf and I co-chair a National Animal Committee. It's actually through an organization called Federal Demonstration Partnership that is under the auspices of the National Academy of Sciences. And that was the #1 complaint that we get during the sort of every quarter, roughly 3 times a year we meet, from the field workers. And every time they kind of accuse OLA of restrictions, and every time Axel points out that the guide allows you to make the variations, and that you can use whatever that professional society has recommended for field animals. And it's important, and again, if you're going through the ALAC, sort of make sure that you sort of define that if you have a field work section, because one of them is, for example, the housing. Again, if you remember that there are some specific requirements in the guide for housing of animals that cannot be duplicated in the field. And a lot of the times it's either because you're doing a short time capture and release, you capture, tag, and release, and it becomes very difficult to do that. So you have to make sure that your criteria allows for those alternative methods, which is more appropriate for the field work. And again, we've already talked about, sort of the ethics committee. By the way, does Colombia use ethics committee or IACUC? Both? Yeah. Because I think I've seen that over the last few years, I've seen more and more countries which are moving towards the ethics committees to use the AEC for Animal Ethics Committee, HEC for Human Ethics Committee, because both of them are now referred to ethics committees. So in order to avoid confusion, but it's good to know that in Colombia we use ethics or both. I think you all know the difference between the major surgery or major operative procedures is intervention that penetrates and exposes a body cavity in or any procedure which produces substantial or permanent impairment or physical or physiological functions. Pain, and again, it's kind of one of the most difficult things. How do you define pain, but again, when we did a survey of most of the regulations, the most common definition is any procedure that would reasonably be expected to cause more than slight and momentary pain or distress in human being, okay, to which the procedure was applied. that his pain is in excess of what caused by injection or other minor procedures. So if you kind of, I mean, although I can tell you that, you know, when my son was young, I mean, if you took him to a regular, just immunization, you would have thought that you were doing a major brain surgery on him, the amount of screaming he did. But now it's sort of excluded, as you can see. But I think this is a good sort of kind of test, but it's somewhat subjective at times, because, so that there are people who say, I have a high tolerance of pain, that's not going to hurt me. But again, that's one of the things that it's really up to the ethics committee to really sort of debate this and make sure that whatever whatever the standard is that you're accepting, it's uniformly adopted. And again, I think you already are familiar. Protocol, both, almost all of the agencies refer or regulators refer to a protocol or a project description, is sort of the other version. Definition, survival surgery versus aseptic surgery, non-survival or terminal surgery, and stress. Now, interestingly, in one of the things which, again, in the US causes a lot of problem is because, a lot of people think that just because it's a non-survival surgery and they're going to do the surgery and at the end the animal is not going to wake, that they can get away, or they don't need to do this, a lot of the alleviation of pain and distress during the surgical procedure, and that's not acceptable. It is considered, that it has to be the same level. Just the fact that the animal will not recover with the surgery will not allow you to do sort of procedures will be causing animal distress. And that's why a lot of the time, in order to even if it's a terminal surgery, like, the pinch test or something to detect the depth of the animal's, anesthesia is an important factor. If you're not doing other kinds of monitoring, but at least a pinch test or something to make sure the animal is not feeling pain during the entire surgery. And I think you already probably sort of used this criteria. Anesthesia must be appropriate to obliterate sensation without endangering animal health and safety. And what this means literally is that this is, again, the critical role of the veterinarians on the committee or the veterinary staff or, sort of people with the expertise, is to make sure that the dosage which is being provided is not low enough to cause pain and stress, but it's not high enough that actually causes more problems for the animals. One of my recommendations, and it's sort of a very common practice, is for you guys, at the committee, in consultation with obviously some of the faculty who do this kind of research, but veterinarians come up with sort of recommended standard doses and dose ranges and medication or drugs, or anesthetics, and sort of make it available as a standard set. That if you are doing this and if you're going to use, XYZ inhalant and you administer, sort of X milligrams or X to Y milligrams per kilogram of body weight, or, that's sort of unacceptable. Because that allows you to periodically update, and as new drugs or medications comes up, then you can easily update. And it takes some of the pressure from the investigators or the researchers who have to constantly kind of try to find out what's the best. So that sort of becomes almost a service that the IACUC provides. And you could do the same thing with actually analgesics and other, sort of local painkillers that are required. Same, we've talked, oops, I think I'm going the wrong way. Okay. Anesthesia monitoring, I think, and I believe you will see that it's in sort of under the ALAC accreditation criteria. This is one of the things that they focus, and when they look at your sample protocols that they want to review, they look at to see how, what's your, if you are doing surgery, what's the criteria that the IACUC has approved, and is it an appropriate criteria for monitoring of the anesthesia during, sort of for the animal to make sure the anesthetic is adequate and that the animal is not feeling any pain sensation. And again, the most common ones obviously is responsive to noxious stimuli, so the pinch test or something similar to that, that if you have the, sort of the instrumentation to look at respiratory patterns, body temperature, heart rate. One advice to kind of both the faculty and to the committees is to be very careful and question and about some of the techniques, because if you're doing a mouse surgery as a survival, and I have seen literally hundreds of these, where they say we will continuously monitor the heart rate, because they think that's, and it's like, what are you using to continuously monitor the heart rate? So be aware of that, and actually ALAC will occasionally point this out to you if you look at it, because again, it's one of those things that be very careful what you define. Once you put it in writing, you have to do it. So be careful, and again, both the committees and the researchers need to be careful not to overcommit. Or sometimes you see actually that, if it's a long sort of procedure that goes on, actually sort of this comes even more post-surgery than pre-surgery, that they will say that we will monitor the animal continuously for 8 hours. Are you really going to sit and watch the animal for 8 hours? Because if you don't, you have violated the committee. So if you see that, ask them to define what does it mean. Now, it may mean that they have a camera system, for example, that they are monitoring remotely from the lab, and if they notice anything, they come back. Or maybe they have instrumentation, that is actually transmitting data, and they're looking at sort of on a monitor on the heart rate or whatever it is for a larger animal. But just make sure that you understand what that means. So this is one of the things that a lot of the IACUCs actually go back and forth, and or veterinary staff go back and forth with the investigator to make sure that there is a clear understanding of what those terms mean. So when you say continuous monitoring, what does that mean? And by the way, again, if questions and comments, please throw them out, And if, what supportive care we do while the animal is under anesthesia. Again, if it's a long range, so the few hour experiment going on with the animal under anesthesia, what are we doing with hydration? What about the temperature? Are we providing heat sort of heat pads underneath? So again, this is the kind of thing that you need to be aware. And we always recommend that they consult a veterinarian who can provide the proper sort of information on what to do. Now, this is a little bit different or tricky when it comes to field work, obviously, because you don't have some of the same thing. So again, what you need to be, although I don't know how many field experiments will have long range of the animal being under anesthesia or animal immobilized. But if that's happening, you need to sort of look at it and see how are they providing support during that period of time. And again, asepsis, again, is to prevent infection, during the surgery, so post-surgery and the recovery period. I think this is the critical thing, and I think this is where, if you look at ALAC, for example, this is what they focus on, that they are looking at the overall program for infectious control or for contamination control. It's not good enough to say that we are sterilizing all the cages. We're autoclaving every cage, we're autoclaving everything, and yet the people who are doing the surgery walk in with their street shoes, and they have their street clothing, and all they do, they just put a lab coat or maybe a sort of wraparound apron kind of thing. You have just completely sort of negated all the things that you did in terms of the equipment, sterilization, and so on. So again, when you're looking at sepsis and contamination control, really it's no different than human surgery. I mean, when you look at the hospital, they don't look at one or two. They look at the entirety from the point of entry to the surgical room, not just equipment, but people. But the same is true of the animal. And again, think of it. If you are taking an animal from the place that it's housed, what about the fecal material? Is the possibility of the urine contamination? Again, to take a contaminated animal and put it in a very nicely sterilized facility and start doing the surgery, what are the chances? that there's the likelihood that you will have cross-contamination of the wound site just because the animal was contaminated at its feet. So again, just think of it holistically. Again, in terms of the technique, I think you will see as you go through the process, one of the things that USDA, for example, does, as does ALAC, as they go around, they look at the sterilization times and the expiration dates, and anything which is expired cannot be used in a surgery. Under certain circumstances, you can get exemptions for some of this to be used in a non-survival surgery. But it would be things like, for example, unopened sterile packs that you buy that has passed the expiration date. But certainly a lot, drugs, for example, anything which is injected or administered to the animal under the current US requirements, once it's expired, you have to throw it out. It cannot be used, even if it's for non-survival surgery. So that's sort of important to realize. Bless you. I think we've already talked about this, and again, sorry? Oh, I thought. So a sterile gown or sterile gloves are done by surgeons who then must drape the, I mean, if you look at it, this is really what we're talking about here, is the process which is the most common process in the hospital. Keep the area, keep the animal, keep the patient, keep the subject sort of covered and only expose the minimum area of that you need to have access to, and that way you are going to minimize the possibility of contamination and ultimately this is the other interesting thing. Again, make sure that everyone who enters the room has the same garb. It is, it's, again, think of it this way. They will not allow you to walk into a hospital surgery room if you are not properly attired and changed exactly as the surgeons and the nurses and so on are. Yet I can tell you over the years, it's amazing how many times you have a postdoc or a graduate student who has come in, taken everything off, scrubbed themselves, put the scrub, sort of clean, scrubbed face mask, and the faculty member who's the advisor just walks in, takes a pair of shoe covers, and it's there to monitor or supervise the student. That's not a very good example to set for your students. How many of you have seen anything like that? He's the only honest person in the room. And again, post-surgical care, I think we've already sort of addressed some of these issues that, typically the definition of the post-surgical says immediately after the incision closed and bandaged. Once you do that, that's the end of the surgery. Now sort of your post-surgical time starts. And this is why, when you start talking about the recovery from anesthesia, again, most IACUC and most processes or procedures actually require that you actually physically look at the animal until the animal is actually recovered from anesthesia. They really don't like you to leave the animal alone during that sort of immediate post-surgery and the recovery. And then, the first dose of pain medication is given immediately after the surgery is over. Of course, if there is a need for the replacement of the fluids or blood, then that happens immediately after that. And then this is, I think I've already sort of mentioned, that should not be left alone until it can lie upright or, on its chest and appears to be awake. So you want to make sure that you do not leave the animal, which is still under anesthetic and not ambulatory, sort of alone without observation. And by the way, the moment you administer this first dose and make a notation on the animal health record, which is required, both by the regulations and by ALAC requirements, that's when the time starts for your next dose. And this is why it becomes important that if you say every 6 hours, that you really go back every 6 hours. So that's why it's better. And one of the most common problems, and actually there are some institutions that do not allow major surgeries to occur on Fridays after a certain hours. And the reason is that, sort of, let's say that if you start your surgery at 4 o'clock, typically by the time you have finished the surgery, wrapped everything, cleaned up, it's 6 o'clock in the afternoon, you know, and let's say you give another hour or so for the animal to recover from anesthesia, so now you're about 7 o'clock in the evening, you administered the first dose, and if you have said 6 to 8 hours, or even 8-10 hours, you know, 2 o'clock in the morning. And unless you really are very sort of good and dedicated person, the likelihood of you missing that second dose is going to be there. So again, as you sort of, and this is important as the ones who are actually managing the surgical suite, or in the veterinarians or the veterinary staff, to keep these things in mind. And again, sort of remind people who want to do the surgery, because it's convenient for them to do it at 6 or 7 o'clock in the evening, that, you know, this means you have to be here 4 o'clock tomorrow morning. And just make sure that they understand that that's what that time frame is. And yes, did you have a question? Oh, sorry. And then in terms of, you know, sort of, as I said, you know, sort of depends on the procedures that are performed, and we've already talked about this, kind of put a range from that. And the other thing which is important is to understand how long after surgery have you said you will do this. So if you have said, you know, for the next 3 days post-surgery, and that's what the IACUC has approved, or, you know, then you have to do it for 3 days, which then means, let's say hypothetically that you have said 8 to 12 hours. That means for 3 days there must be at least 6 administration of analgesics, because even if you're doing it every 12 hours, there's 3 days, 12 hours, so there has to be 6. Actually 7, because there is 6 plus 1, which is immediately post-surgery. But post-surgery, there has to be then a record that somebody has put in, an initial record that you have done at least 6 additional post-surgery. And obviously, if you have said 8, you know, if you do it at 8, that's fine. You know, you can do longer. But it's just, again, very important. And one of the sort of side notes on this is, I don't know if it's a practice. How many people who are actually researchers, who actually use animal for research? Perfect, okay. So most of the times when I've been kind of responsible for the animal care program, or even, you know, in my lab, one of the things that I make sure that is every member of the team has read the protocol. And I have them to read the protocol in its entirety and sign a piece of paper that they have read and understood, and then I ask them if they have any questions. Because it's unbelievable how many times the problems occur, because people only read a component of the, you know, so that the technician only reads a little part of the thing because that's what their job is. The person who's going to do the surgery reads that part of it, and they're not familiar with the rest of the protocol. So it's really a very good practice to have everyone in your group read and understand all the elements of what you are committed to and make sure that they follow that. It's just a very simple process. It doesn't take a lot of time. Most protocols takes maybe half an hour for someone to read, and then encourage them to ask questions to clarify so that they understood. And actually, it's amazing once you establish that how many of these problems go away. And again, it's nothing that people do it deliberately. It's just that, you know, they think it's the right process because the training said do this, but your particular protocol, for good reasons, experimental or whatever, has a slight modification from the standards. So, and again, you know, this is, you know, sort of very important. You have to follow the protocol exactly as written. Any changes, you have to go back to the IACUC before you make the changes. The only exception is if there are animal health or welfare issues, and you consult the veterinarian. And the veterinarian agrees to that, in which case you can implement, and then retrospectively go back to the committee and notify the committee. I'm sure that you will hear from ALAC accreditors, but I can tell you that USDA inspectors and so on says, if it's not written, you didn't do it. Document, document, document. If you didn't write it, you didn't do it. So, I mean, That's kind of essentially documents, So I think you already probably, I'm not going to go a lot through the, sort of the things to look for as signs of pain: decreased activity level, food or water consumption, loss of body weight, obviously, limping or other disuse of body parts. These are sort of just standard observational things that when you look at the animal post-surgery and you start seeing that if the animal is not moving as much as they should be for that period post-surgical survival, that's a good sign or indication to recognize that there might be some pain in there, because that's what the animal gets hunched back. They don't eat or drink, what's wrong? And biting, striking at the surgical site, it's again a sign that there is a pain, because generally speaking it doesn't happen. So this actually, so that we've already talked again, this is not just anything which has got to do even with the assessment of pain, because sometimes for larger post-survival, large animals, you're required to do an assessment and determine whether there is as needed, or PRN is another alternative that you may want to use after the first day, which basically allows you, if the committee approves, that if you go back and do an assessment of the animal and document that you've assessed and the animal is showing no sign of pain or distress, there's no need to give them additional medication. Because at that point, if you're giving them additional painkillers, in essence, you're actually kind of slowing down the recovery, because to some extent you're kind of dosing them unnecessarily with painkillers. So under some circumstances, the committee can and you could review and agree that you will do the first obviously dose, but then you define how you're going to assess the pain criteria. For example, that you're going to be looking at it every 8 hours. You're looking to see if the animal is active, normal, if the animal is eating, drinking normally, if there is no body weight, the animal doesn't seem to be limping or showing any other signs of distress, or there is no biting or surgical. So you do all of this assessment and you determine that at that point the animal is normal and is up and running, then you decide not to give a dose of additional painkiller at that point. It's okay, because but then you have to document the fact that you did the assessment and define how you made the assessment, which determined that the animal is no longer in need of additional painkillers or analgesics. I think we've already sort of talked about this a few times. Document, document, document. I know it's a pain in the neck, it's a very difficult, and the last thing you want to do is, when you've just finished a 2-hour surgery, to start writing records. But it really is extremely important. And every time you walk in and out of, my recommendation is over-document. I used to say to technicians that basically every time you walk in and out of the room, make a notation, because at least there's a record that you were in the room. And you don't have to write a whole complete works of Shakespeare. It could be observed animal, all okay. That's all, But at least there is a record that you have been continuously looking at the animal and somebody has been in there. It's a good idea to always add the time and the date and the name of the person who did it. A lot of people like to put their initials, but it's really kind of not. It's good if it's a small program and you only have a few people. But if you have a very large program, when I was at University of California, San Francisco, at a given time we had about 900 active projects, 900 active IACUC approvals. And there were something like 1,800 people. What are the chances that AT is only Ara Tahmassian? It's probably like there is at least another 50 people whose initials are AT. So putting AT doesn't mean anything, So I would just say put the name, just sort of again, advise your technicians, advise the staff who work with you, the graduate students and so on, to do this. So the document medications that you had. And then one of the things that you may want to sort of consider, the researchers, So that once you have done your first one or two kind of procedures, whatever the procedures are, whether it's surgery or others, under that particular protocol, go back and look at your protocol and see if there are things that you would like to change. And that's a very good time. It's sort of almost like use the first 2 or 3 procedures as a pilot. And then if there are things that you say, well, I wish I could, that's a good time to go back to your IACUC and ask for a modification to make the changes, okay? So again, a good example of it would be the post-surgical care. If you've done a few of these, 2 or 3, and then you notice that in almost every single one of them, your animal was up and running after day 1, and there's no need to come in for 3 days to do the same monitoring, then that's a good justification, because now you have some actual facts and information that you can go back to the IACUC. So to put that in the back of your mind as a possible way of going back and modifying and refining the project as you go on. Yeah, this is, I think I've already mentioned this, is that, sort of be careful about what you said and the frequency. And these are actually taken from some real protocols. So that this is like, we will monitor the heart rate every 15 minutes, and we will look for signs of pain daily, okay? That's a little bit more reasonable than when the person says, with mice, we will do a continuous heart rate monitoring. And, during the first 2 days, we will have a continuous monitoring for signs of pain. How are you doing a continuous sign of, unless you're standing there and observing the animal? So this is a little bit more reasonable, because it says that sign of pain daily. Now that means, at least once every 24 hours. Now, you can't go in at 11:45, sort of Saturday evening, and then 12:15 on Sunday morning, and then don't show up until Monday and say, well, it's daily. It's kind of, that's not acceptable. And believe me, I've seen that trick. It doesn't work. This is, you may want to, I don't know whether it's a criteria here or not, but the IACUC may adopt that when you have a small group of small animals, like for example, if you have a series of 7 mice or 10 mice, that you're doing exactly the same procedure, exactly the same process, rather than identifying each one of them and keeping the individual records post-surgery for all of them, you could actually group them as a group and keep a record of that group, But that's something that it has to be within your IACUC's accepted procedures. If it isn't, it's worth considering that, because it reduces significant amount of burden in record keeping. Veterinary communication, even though it is actually a regulatory requirement, especially for the larger animals, which are covered by USDA regulations, and as well as the EU requirements. My recommendation is that have a constant communication as the researcher with the attending veterinarian, and sort of ask their advice, and just talk to them all the time, because one of the good news, advantages of that is now you have a report. They have a better understanding of what your research are. They have a better understanding of what your issues are, and hopefully they can, advise and guide if things are going wrong. Okay, rather than it becoming a problem that then brings in the IACUC into a post, sort of almost a non-compliance situation. And again, we talked about the fact that if you talk to the veterinarian, it could be by email or it could be by phone, and they approve a variation, make sure that in your actual record, when you're recording the animal health, whatever it is you've done, in that animal record, you add something that acceptable procedure per, Dr. X, and time and date that you talk to the person, because now there is a record, okay? And again, the same thing is that, if there is a changed drug, a dose started per consultation with Dr. X. So again, if you're making the changes in the process when you're starting the drug, or anything that you get approval from the veterinarian just make sure that you make a note of it at the, in the medical records or the animal chart. Euthanasia, I think again, do you follow the AVMA veterinary, or does Colombia has its own requirement? Is it the same guidelines as the Guide for Animal Care? Okay, because the animal care for regular lab, animals actually uses the American Veterinary Medical Association, AVMA euthanasia guidelines, and with the exception of field animals, which you can actually then use whatever the professional society is recommending. And that's pretty much true for the EU and Canadian requirements as well. I think, again, this was a very quick sort of run through because I want to open up for discussion of the process. In most instances, there are no problems, and I would say that 95, 96, 97% of the animal research is going on in accordance with sort of approved the protocols. The unfortunate thing is, and this is sort of very critical, I think, is that there is an opposition to animal experimentation. And every single or every simple violation or every single issue that comes up is grossly exaggerated and used against, sort of the community. It's very interesting that if you look at the USDA, for example, in the US, that is required to do an inspection of all of the institutions that use animals which are covered under the animal welfare. In other words, anything other than mice, rats, and birds. They post their findings online. And if you look at a lot of the violations that they find are often administrative violations. A change in the procedure which was not approved by the IACUC before the procedure was implemented. Yet if you look at the reports then that some of the anti-animal research groups put together, is they take each one of them. So there was a report recently issued by PETA, People for Ethical Treatment of Animals, in which they actually counted one by one. And it was like, sort of 4,500 violations. And if you look at it, it's completely misrepresented. And unfortunately, that's what the media captures. So I think, it's really important for us to do this right. And I think really sort of it's important to kind of be a little bit even more careful than we are with human subjects and sort of avoid, because again, if you go back and look at majority, and I mean this as an overwhelming majority of the violations that are found or the findings are administrative in nature. They really are not animal welfare. There are very few animal welfare issues. But it doesn't matter. It sort of still shows up that, Harvard University researchers racked up X, or Columbia University researchers, violated the Animal Welfare Act 163 times. But it's still something that it's very bad for the headlines. It's good for them, it's bad for us. So with that, I open up for discussion, questions, comments. Yes.
From the IACUC perspectives, which are the options to this post-approval monitoring in the field research projects that take into account wildlife?
So that's a very good question. Two things. My recommendation is make sure that your IACUC actually has field researchers. That's number one. Number two is actually it's not a bad idea to look at all of your procedures or requirements and create a parallel document for field work. Again, if you look at post-surgical care, for example, in an animal facility, it's completely going to be different than it is in the field work, okay? So if you have managed to actually sort of put this into a process that is a standard practice, you just check box and oh, sorry. Oh, sorry, it's okay. So IACUC should look at it from a practical perspective, and again, I don't want to criticize IACUC because a lot of the times IACUCs, for good reason, are the most conservative perspective. But I think it's very important that if you haven't done that, to educate the IACUC that there is a difference between field research and lab animal science, actually in the facility research. I'll give you an example, and maybe this will be illustrative. A few years ago, the committee that I co-chair, in one of the meetings, the complaint that came up is that the IACUC was refusing to approve a researcher's project, which was a field research, and include tagging and taking blood samples, hair sample, and something else for genetic analysis of, and I can't remember, it was a species of monkeys in Borneo. All right? And they were going to sort of dart them, bring them down, do whatever they were going to do, put them on a makeshift cage that they were making from bamboo locally, and they were going to let the animal, once the animal was up and sort of running, they're going to let them out. And the IACUC was asking for socialization practice. And the fact that sort of the cages did not meet the criteria because they had to guarantee that if you look at the guide, there is I forget the dimensions, but there's a minimum size. And that when you stack the cages, if there is a justification for the animals to be single housed, because let's say it's an aggressive animal, but then they have a site to other animals. And this is impossible in a field work because the person actually had a few pictures, slides to show that they have an open clearing, it's about this small. And there's no way that they kind of do what is being asked for. And the chair of the IACUC, who was at the meeting there as well, it took quite a lot of discussion to make the IACUC chair understand that you need to sort of go back and modify. And there are many other ways. And one of them, we always say, go look at the professional society or organization for that particular group. And again, if you look at mammalogists, for example, or ornithologists, if you are into the birds, they have field guide criteria. And obviously, they are not violating the regulations or the guides. But if your IACUC has not adopted it, then unfortunately, you're stuck with whatever the criteria your IACUC has. And that's what I say, go back and make sure that the IACUC is aware, understands the field work, and whatever criteria they have is adopted and it's in writing. Because if your animal care guide right now, I don't know what the policies are, the procedures and guidelines, who's from the animal facility that runs the animal facility? Is there anyone? Yeah. Ah, okay. So if your practices says that, no more than 6 mice in a cage, and the dimensions of the cage has got to be 11 inches by 4 inches by 8, I don't know, I'm just making up some numbers. All right. So if those numbers, if that's what you have said, but you don't have a statement which says exception of this is for the field work, in which case, we will go with the justification of the individual. Then that's the criteria. So if you're going to the field work and you're doing some field research in field mice, and you start picking up field mice, then you're obligated to keep them to less than 5 or 7 or whatever the size, whatever the criteria is with the guide. Does that make sense? Does that answer your question? Yeah. Educate your IRB, or IACUC rather, sorry. Other comments, other questions? Yes?
Do you have a policy for undergraduate students that work with animals?
Yes, undergraduates. So the question was, do we have a policy for undergraduate students? Yes. No difference. We do not distinguish between the status of whether you're a full tenured professor or whether you're a student. If you have contact with the animals and you're involved in animal research, same criteria. Same training requirement based on what you are going to do with the animals and so on. Is it different here? Do you have different criteria or?
Actually, now we have a policy in which undergraduate students cannot work with animals. But we are going to start the process now. So I was wondering if you have something different for them.
No, we use the same criteria. Is that if obviously you have to, sort of the training and so on. The good news is that in most cases, I would say in probably better than 85–90% of the time, the undergraduate students tend to be more into very low risk kind of studies. Often they're participating in things which is observational, sort of psychologists who are doing sort of observational or running maze tests and so on. You don't get a lot of them who go for the field, but every now and then you do get field tests, but that's what we're doing. The bigger issue for us in most institutions is once you put the students into the animal world is the medical surveillance with them. Because, sort of the way we have the undergraduates, in the US the way it works, that undergraduate students are covered by a separate health plan. And it's sort of and what you find out is that if the medical surveillance requires additional immunization or testing, then the question becomes who pays for it. Because their health insurance, the student undergraduate health insurance often doesn't cover that expense. So that's always covered by the sort of central, either by the researcher or by the school or by the provost, whoever is running the medical surveillance program, the health program. That's the bigger issue. Yes, ma'am.
Yes, very often the researchers think that they can modify the research groups if they are not changing the procedures or the medication or all the welfare protocol. They can rearrange the research groups. What do you think?
When you say research groups, are you talking about the animal groupings that they have approved or people who are working with the research?
No.
Yeah.
Treatments in the number of mice with each treatment in the research.
Yeah. No, if you have defined, again, if you have said group A is 24 mice and this is what we're going to do and this is what will happen, that's what you have to do. If you want to make that change and switch that with whatever you're doing in group B, that's a modification of your approved protocol that needs to go back to the IACUC with some sort of a justification as to why you're doing that. Other questions, other comments? Yes?
I would like you actually deal with those projects of research related with the alien species control. Why? Because in so many times all of these projects end in situations like pest control and things like that. How do you think it could be made with these projects, or is there any route or any way to deal with those kinds of projects?
So when you say pest control,
Yeah. For example, alien species, right now we have here in Colombia a lot of problems with alien species. Those, in the future, many people are going to present projects related to those species. Maybe at the end, all of these species must be controlled.
yeah.
Maybe one of the means of control is
Yes. So the question of how do you control species and what does that mean, that's a problem that occurs in many areas. I mean, Florida, state of Florida has a huge problem with actually pythons. And, and what has happened is that people who thought that these Burmese pythons that were cute when they were about this big had purchased over the years these animals and ended up actually, kind of finding out that that animal keeps growing and growing and growing and growing. And at some point, that small aquarium, lucite plastic that they had, it doesn't fit, then they release them. And if you know anything about state of Florida is the ideal breeding ground for that species because it's hot, it's humid, there's a lot of kind of what we call the Everglades, which is floodplains, okay? And there is no natural predator. So over the years, it has become a massive problem. And you know, it is not uncommon, and you can almost every day, there is a news article somewhere up and down Florida where it's in somebody's backyard, it's in a swimming pool, it's, you know, sort of next to a dog, or somebody's dog disappeared, or, you know, the mother comes out in the backyard and there's this python standing next to the kid. Not boa, sorry, I said python, I mean boa, not but anyway, so the question has become, what do we do with that? But because the extermination or extermination of that is not considered as an experimental procedure, that does not require an IRB. It does require additional approvals from the Fish and Wildlife, you know, which is the entity that manages the wildlife in the U.S. So you have to go to the Fish and Wildlife, and actually in Florida, they actually have issued blanket permits for people, so you don't need for each individual to go to get that. So that's a sort of a big problem. But if you are not doing a research on that, then you don't need to go through the IACUC. Now, if you were kind of looking at a very narrow scientific question of what causes these animals to, you know, sort of multiply more faster, and you wanted to go and observe them in the field, then that's sort of field research. But if it's just purely because they're a pest, and you're doing a pest control or extermination of the non-invasive or you know, sort of, or non-native species or invasive species, you don't require. You have to look whatever your local fish or your wildlife requirements are. You know, whatever entity it is that is regulating it. I mean, the same thing happens in some areas in the U.S. For example, there periodically an explosion of the deer population. That, you know, so that there are certain years that the population of deer really becomes very large, and they start sort of coming into the towns, and they cause other hazards, you know, for traffic or accidents and so on. And under those circumstances, the local authority, whoever the agencies that regulate that, may allow a period of time where, you know, to hunt these animals, you don't need to obtain a permit. Other questions, other comments? Yes? Because they're recording, so
yeah, we're going to try to get the accreditation from ILAC, right? But you say, for example, if we want to apply to an NIH grant, right? So we need the accreditation. And you say, let's say we have a collaboration with somebody in Harvard, right? And then how willing are institutions to come and visit the facility so we can apply, for example, with Harvard?
Sure. Yeah. So the first, I mean, my recommendation is that if you really want to do sort of research using federal funds, you know, NIH funds or National Science Foundation. By the way, National Science Foundation and NIH are exactly the same when it comes to the animal care. In fact, Office of Lab Animal Welfare, OLA, actually sort of provides the same oversight for NSF-funded National Science Foundation research, as well as the ones from the National Institutes of Health. Go online and look at federal-wide assurance, okay? So take a look at it, and it will tell you that under the federal-wide assurance, what are the requirements to get, sort of to be registered with the OLA as a registered IACUC, as a registered program. And just make sure that your program has that requirement, because if we come, let's say that if you were doing sort of a research with School of Public Health at Harvard, and you're not still ALAC accredited, you know, you're waiting for that. One of the things that we're going to be looking at, you know, whoever comes in to do a site visit or whoever sends you a message and asks for information, essentially it's going to be following the same checkbox as the OLA checkbook, because we have to make sure that whatever you have in place is in line with what the OLA asks us to do, because otherwise we cannot sort of collaborate with you. So I would say that until you get, when do you think you will get the ALAC? How close are you to ALAC? Do you know?
2 years.
2 years, okay. So until you get the 2-year accreditation, until then, one of the first things that you should do is go to OLA, the Office of Lab Animal Welfare, look under their website. I don't know if we have, let me see if, the link might be here. I went too fast, sorry. I'm looking for the OLA website. No, it's not on this. I think it's on the first. But anyway, if you go to the OLA website, you know, which is stops here. You know, if you go to the grants and then you look at OLA, or if you just do a Google Office of Lab Animal Welfare. Oh, is it? Do I have it? Where is it? Oh, there. Oops. What did I do here? Come on, help me. Somebody help with this one. I pushed the, what did I push? Okay, let me go back to, sorry. Okay. Is it back? Yeah, okay. Sorry. All right. So, no? Why is it saying the end? Okay, all right. So, hopefully this will work. Okay, so how do I get this to show here now? Oh. Yeah, just one more. Yeah, close that. Okay. Yeah, so if you look under the OLA, here it is. See, it says obtaining an assurance. So, it sort of gives you the criteria, so that what does it take to take an assurance, and then obviously it says institutions must have an assurance on file with OLA to receive public health service funding. So you need to make sure that you have this in place. So this is sort of the first way of doing it. And it says that so then here is the process. And here is the specific requirements for foreign assured institutions. So, sorry, I'm not very good in doing things in the opposite direction. And this is, by the way, these are the listing of institutions which currently have obtained assurance, okay? So if you look at it, there's Argentina, Australia, Austria, Bangladesh, Colombia. So you go to Colombia, and let's see who in Colombia has actually received an assurance. I don't know what they are, but I'm sure you know who they are. But yeah, so here is sort of two institutions or two entities in Colombia who have received. And once you get it, once you're added to the list, then anyone who wants to do, or when you apply to the funding, they usually don't talk to you. We all go to this site and we look and see if you're not on the site, then we start the discussion about what do we do. So this is kind of an example for you of, but if you go back to the, foreign assurance. So here it is. So then there's the criteria that, sort of foreign assurance are negotiated that control their own animal facilities, which is what you have, conduct animal research on site, which is what you have, and have an animal care and use program with an authorized official, which is what you have, So then, you provide components of the institution that will be covered by the assurance. What it means is that you have to define which part of your research, because some institutions choose to have more than one assurance. Faculty of Medicine wants to have theirs, Faculty of Sciences wants to have theirs because they don't want to mix with each other. So if you have a scenario where there's more than one animal care program, then you define what is covered under your program. That's what it's talking about. What are the components? In your case, I assume that there is a single program at the institution, and you sort of define that, including the elements of the field work that is happening. And again, sort of commitment to, the sort of biomedical researching, and an institutional endorsement. That means, whoever your institutional official is, usually, typically, you want someone from the office of the provost or the vice provost, or even the president, someone to sign that, saying that the institution is supporting your application and that you have their support. And again, sorry. And here is a sample for a foreign assurance, that you can follow. So it's a little bit of a paperwork. It takes a little bit of a time, but as you are putting, it sounds like you may not have a big problem because you already are on the path to ALAC. So a lot of the documentation will be available, and it would be good also to, when you're applying, either somewhere in the description or in the cover letter, to identify that you either are applying or have applied or on your path to accreditation. So that's sort of a positive. But here is how you get it. So if you go to the OLA site, just follow the instructions, and okay. Other questions, comments? Okay, thank you very much. Appreciate it. Thank you.